For years, Viagra and Cialis have been household names, the quick fix that helps millions of men regain confidence in the bedroom. But what most men don't realize is that using them too often can come at a cost. Studies are now showing that long-term, frequent use of these pills may do more harm than good. Not because they don't work, but because they can quietly change how your body functions over time. A 2023 review published in the Journal of Sexual Medicine found that about 1 in 4 men who use PDE5 inhibitors like Viagra or Cialis regularly experience weaker natural erections when they stop taking them. In other words, the very pill meant to help performance can sometimes make your body forget how to perform on its own. And that's not the only problem. Over time, dependency, hormonal imbalances, and even vision and heart issues can start to appear in men who rely on these pills too often. That's what we're going to break down in this video: the long-term side effects that most men are never told about, and how to protect yourself if you're using these medications. To understand why overusing Viagra or Cialis can lead to long-term issues, you first need to know how they actually work. Both drugs belong to a class called PDE5 inhibitors. When a man becomes aroused, nitric oxide is released in the body, which relaxes the blood vessels in the penis and allows blood to flow in. That's what causes an erection. PDE5 inhibitors block an enzyme that breaks down this nitric oxide signal, keeping those vessels open longer and allowing for a stronger, longer-lasting erection. Now here's the key. These drugs don't increase desire or fix the root cause of erectile dysfunction. They simply enhance the chemical reaction that creates an erection. If you're using them occasionally, that's usually safe and effective. But if you're relying on them frequently, your body can start to depend on the drug to trigger the process. Over time, the brain and blood vessels can become less responsive without the medication, making natural erections harder to achieve. In short, instead of rebuilding your system, the constant use of these pills can mask deeper problems like low testosterone, poor circulation, stress, or pelvic floor weakness, and make them worse. Viagra and Cialis were designed to be short-term aids, a temporary boost to help improve performance when needed. But when men start using them regularly, the body begins to adapt in subtle ways. Here's what's really happening. Normally, an erection starts when the brain sends a signal to the nerves in the penis, releasing nitric oxide. That nitric oxide relaxes blood vessels, increases blood flow, and traps that blood to keep the erection firm. When you take Viagra or Cialis, the drug blocks the enzyme PDE5 that would normally break down nitric oxide. This means the signal lasts longer and the erection stays stronger. The problem is, when you use these pills often, the body stops relying on its own nitric oxide pathways and starts depending on the medication to do the work. Over time, natural responsiveness weakens, kind of like how your muscles get weaker if you stop exercising them. A 2022 study in the International Journal of Impotence Research followed men who used PDE5 inhibitors 2 or more times a week for over a year. When they stopped, 37% experienced significantly weaker erections without the drug compared to before they started. Doctors often call this a form of functional dependence. It doesn't mean the drugs are addictive in the traditional sense, but your body becomes conditioned to need them to perform. That's why many men notice that even if they skip just a few days, their natural erections feel softer or take longer to achieve. It's a feedback loop. The more often you use the medication, the less your body produces nitric oxide naturally, which then makes you feel like you need the medication even more. That's how dependence quietly builds over time. Most men are surprised to learn that the same enzyme Viagra and Cialis block in the penis, PDE5, also exists in small amounts in other parts of the body, including the eyes and ears. That's why, when these drugs are used frequently or in higher doses, side effects can show up in places you'd never expect. Let's start with the eyes. Inside the retina, there's a related enzyme called PDE6, which helps the photoreceptor cells in your eyes process light and color. When you take Viagra, it doesn't just block PDE5, it also partially inhibits PDE6. That's why some men experience temporary changes in color vision, light sensitivity, or even a blue-green tint after taking the drug. But when used too often, this effect may go beyond temporary. The American Academy of Ophthalmology has reported cases of retinal toxicity linked to long-term PDE5 inhibitor use, especially in men who take higher doses for many years. In rare cases, chronic exposure has been associated with a condition called non-arteritic anterior ischemic optic neuropathy, NAION, essentially a loss of blood flow to the optic nerve, which can lead to permanent vision loss in one eye. While this is uncommon, the risk rises in men with diabetes, high blood pressure, or a history of eye problems. Now for the ears. Hearing issues are less talked about, but just as real. The U.S. Food and Drug Administration has documented over 100 cases of sudden hearing loss potentially related to long-term use of PDE5 inhibitors. Researchers believe it's due to reduced blood flow to the cochlea, the part of the inner ear responsible for sound processing. Once that blood supply is interrupted, it can cause tinnitus, ringing in the ears, partial deafness, or muffled hearing that sometimes never fully returns. These side effects don't happen overnight. They build with frequency and dose. The more often the drug is used, the more the body's blood vessels and sensory tissues are exposed to those enzyme-blocking effects. So if you've ever noticed changes in your vision, color sensitivity, or even ringing in your ears after taking these pills, it's a sign your body's starting to show stress. It doesn't mean you have to stop completely, but it's a reason to scale back and talk to your doctor before the damage becomes permanent. Viagra and Cialis were originally developed as heart medications, not for sexual health. That's because both drugs were designed to dilate blood vessels and increase circulation. In the penis, that's a good thing, but throughout the rest of the body, especially in men with heart conditions or on certain medications, that effect can create serious complications over time. Here's how it works. These pills relax the smooth muscle tissue in the blood vessel walls, allowing more blood to flow through. This drop in vascular resistance lowers blood pressure. If your cardiovascular system is healthy, your body can usually handle it. But if you're already on blood pressure medications, nitrates, or alpha blockers, the combination can send your blood pressure dangerously low. According to an FDA safety report, combining Viagra or Cialis with nitrates, commonly prescribed for chest pain or heart disease, can cause blood pressure to plummet to life-threatening levels. This is why doctors always warn against mixing the two. Some men experience lightheadedness or fainting, but for others, it can trigger chest pain, arrhythmias, or even heart attack-like symptoms. Now here's the long-term problem. Even without nitrates, using these pills too often can stress your cardiovascular system. A 2021 study, published in Cardiology and Therapy, found that chronic PDE5 inhibitor use may alter vascular tone, meaning your blood vessels lose some of their ability to naturally expand and contract on their own. In plain terms, your circulatory system gets used to the boost and becomes less responsive without it. And because Cialis stays in your system for up to 36 hours, that vasodilation effect can linger, especially if doses are stacked or taken too frequently. Over time, this can lead to chronic low blood pressure, fatigue, dizziness, and reduced blood flow to key organs, including the heart itself. For men over 50, this is especially important, as arteries naturally stiffen with age. Adding constant vasodilation can increase the strain on your heart as it tries to maintain stable pressure. In some cases, that stress can worsen existing heart conditions or make recovery from cardiovascular exercise slower. If you notice chest tightness, shortness of breath, or frequent lightheadedness while using these drugs, it's not something to ignore. That's your heart telling you it's working too hard to balance the effects of the medication. Viagra and Cialis aren't hormonal drugs. They don't directly affect testosterone or estrogen levels. But long-term use can indirectly change the body's hormonal balance in ways that slowly impact energy, mood, and sexual performance. Here's why. Healthy testosterone production depends on signals that start in the brain, specifically the hypothalamus and pituitary gland. These areas release hormones, LH and FSH, that tell the testes to produce testosterone. But when a man relies on Viagra or Cialis frequently, The brain begins to associate sexual performance only with the medication rather than its own hormonal cues. Over time, that feedback loop can weaken. A 2021 review in Frontiers in Endocrinology found that chronic PDE5 inhibitor use may reduce luteinizing hormone LH activity, the key hormone that drives testosterone production. Lower LH means less natural testosterone output. In the short term, you may not notice it. But after years of frequent use, men often report fatigue, lower libido, and a drop in morning energy, classic signs of mild testosterone suppression. Another indirect factor is how these drugs can change blood flow dynamics. Constant vasodilation can alter circulation in the testes, slightly reducing oxygen supply and affecting how efficiently testosterone is produced. A 2020 Italian study published in Andrology observed that men using PDE5 inhibitors more than 4 times per week had lower average testosterone levels compared to men using them occasionally. The irony is that many men start using Viagra or Cialis to feel more like themselves again, more confident, more energetic, more alive. But if you rely on them too often, the hormonal side effects can have the opposite effect. You may find your natural drive fading and your dependence on the pill increasing just to feel normal. That's why doctors now emphasize cycling, using these medications periodically, not continuously, while working on the underlying issues that cause ED in the first place, like poor sleep, lack of exercise, or low vitamin D and zinc levels. Those are the factors that truly support healthy testosterone production long-term. This is one of the most overlooked, yet most common, long-term side effects of using Viagra or Cialis too often. Physical dependence is one thing, but psychological dependence can be even harder to break. For many men, that first successful experience with the pill brings an immediate boost of confidence. Suddenly, something that used to cause anxiety or frustration feels effortless. The brain learns to associate that success with the medication, not with its own ability. Over time, this creates a form of conditioning. The more you rely on the pill, the more your mind starts to believe you can't perform without it. A 2022 paper in Sexual Medicine Reviews described this as performance-linked psychological dependence, where confidence becomes chemically tied to the presence of the drug. In studies, up to 40% of men who used PDE5 inhibitors regularly reported anxiety or fear of failure when attempting sex without medication. This mental loop can quietly grow stronger with time. The man may begin to pre-plan intimacy around when he takes his pill, avoid spontaneous encounters, or even experience panic if he forgets his dose. The brain, in essence, becomes addicted to the certainty that the medication provides. And here's where it gets tricky. When you combine psychological dependence with the physical effects we discussed earlier, like reduced nitric oxide production, the body and mind start working against each other. Even if the physical ability is still there, the anxiety alone can block arousal or performance, making it feel like the problem has returned, when in reality, it's mostly mental conditioning. Breaking that pattern isn't easy, but it's absolutely possible. Gradual tapering, rebuilding confidence through pelvic floor exercises, improving blood flow naturally, and addressing lifestyle factors like stress and sleep can help the body and brain reconnect. The goal isn't to completely avoid Viagra or Cialis. It's to use them as a tool, not a crutch. When you regain trust in your body again, the performance anxiety fades and the dependency cycle starts to reverse. If you've been using Viagra or Cialis frequently, the goal isn't to quit cold turkey. It's to regain balance. These pills can absolutely help when used correctly, but they were never meant to replace your body's natural function. The key is to fix the root causes, not just treat the symptom. Most doctors now suggest cycling your use, taking these pills occasionally rather than relying on them every time. This gives your body a chance to restore its own nitric oxide production and responsiveness over time. You can also strengthen your natural performance through lifestyle changes that rebuild circulation, hormone health, and pelvic floor strength. Studies show that even 30 minutes of moderate exercise a day can improve erectile function by up to 40%, and foods rich in nitrates and antioxidants, like spinach, beets, and pomegranate, help support blood flow naturally. Regular pelvic floor training, which we've covered in detail in another video on this channel, can restore firmness and control without any medication at all. Hormonal balance matters too. Quality sleep, healthy weight, and nutrients like zinc, magnesium, and vitamin D can all help keep testosterone levels strong. We also have videos that explain how to boost testosterone naturally and support better circulation without relying on pills. And finally, the mental side plays a bigger role than most men realize. Once you start rebuilding physical confidence, gradually reduce your use and allow your body to take over again. The goal isn't to abandon these medications entirely. It's to reach a point where you don't need them every time. Viagra and Cialis have helped millions of men regain confidence, but long-term reliance can quietly take that confidence away. When your body starts depending on a pill for every moment of intimacy, it's not just your performance that changes. It's how you see yourself. These drugs can be powerful tools, but only when used with the right balance. The real goal is to restore your natural function, to get your body working the way it used to. That means rebuilding circulation, hormone balance, and pelvic strength, not just covering up the symptoms. And the good news is, you can absolutely do that. We have multiple videos on this channel that walk you through natural methods to improve performance, boost testosterone, and strengthen your pelvic floor without relying on medication. If you found this video helpful, make sure to subscribe and check out those other guides next. They'll show you how to safely rebuild your performance from the inside out, because the ultimate goal isn't to take a pill forever. It's to get your confidence back naturally.